Completed the scene size up, we're now going to treat our patient. As I approach the patient, I notice the position and colour of the patient. The patient is sat up, their mouth is dropped open, and they appear to be a nice, warm colour. Speak to the patient. Hello, can you hear me? Is there any response from the patient?
Patient says hello.
Patient says hello. So I'm noting immediately that on the aptitude scale, the patient is alert. Can you tell me what's been happening today, sir? Have I noticed any problems with the patient's breathing, or is he able to communicate with me?
Slight difficulties even able to communicate the sentences. It just says that he's feeling unwell.
Okay. I'm aware at this stage that his mouth is open, he's speaking to me. I can't hear any wheeziness, and looking at his mouth, there doesn't appear to be any problems with his airway. So I'm happy that his airway is okay. I'm now going to move on and look at the respiratory assessment of the patient. Okay, sir, what we just need to do is put a small probe on your finger just to see how much oxygen is in your blood. I'm going to ask my colleague to apply the SpO2 probe, and at the same time I'm going to note the rate and rhythm of breathing. I'm not going to tell the patient I'm going to do that. I'm just going to rest his arm across his chest and count. I know the patient's respiratory rate is 16 per minute, his chest moving adequately on both sides. What's my SpO2 reading, please?
SpO2 is 92%.
His SpO2 is 92%, so I want to maintain his oxygen levels at around 92 to 94%. Therefore, I'm going to ask my colleague to apply a variable flow oxygen mask at a rate of about 6 litres per minute. Okay, so we're just going to put some oxygen on your face before we check you over. At this point, I know the respiratory rate of the patient, and I know that his chest moving adequately. I now want to do a proper examination of the chest. I'm just going to put my hands either side, sir, and I'm just looking for rise and fall of the chest. Have I got bilateral rise and fall of the chest?
Yes.
I'm now going to find my stethoscope. Okay, sir. Can I just have a look at your chest, please? I just want to examine your lungs if I can. I'm going to expose the patient appropriately for the circumstances. I'm in a nice warm environment, so that's fine. I'm going to look at the chest. Can I see any rashes, bruises, or any other indications on the chest?
Chest clear.
Chest clear. There's no medication patches and no bracelets?
No.
Okay. I'm going to have a listen with my stethoscope. Okay, nice breath in. Back out. Back in. Back out. Is there anything to note in his chest at all? No wheeziness, no crackles? Okay, so his chest is clear. If the patient's able, I may ask him to sit forward. Can you give me a hand to sit forward, please? And I'll now have a listen to the back of the chest. So note from that the patient's respiratory level is adequate. His saturation levels are 94% now on variable flow oxygen. There's no injury, illness, rash, medication patches on the patient's chest. That concludes my assessment of the respiratory system. I'm going to move on now to look at the circulatory system. I've already noted the patient's skin colour and temperature. He appears to be adequately perfused. I'm going to feel the skin. Is it warm or cold? It's warm. Does it feel as if the patient has a temperature?
No. It's warm and dry.
So we've got warm and dry skin. I'm going to take a peripheral pulse. Can I feel the radial pulse? I know that the patient therefore has blood pressure of at least 90 millimetres of mercury. I'm going to take his pulse. It appears to be nice and regular, so I'm going to take it for 15 seconds and then time to 5-4. The patient's pulse appears to be 80 beats per minute. I can feel it peripherally, and it appears to be regular and of adequate volume. It is. Okay. So I don't need to check central pulse because I know I've got peripheral pulse. I'm going to take the patient's capillary refill. I'm going to press for 5 seconds and release for 2.
2 seconds.
Capillary refill is 2 seconds at the peripheral. Okay. I'm going to ask my colleague to attach the 3-lead ECG. And at this point, I'll just have a quick listen for heart sounds. Listening over the apex. And the heart sounds appear to be clear. Okay. We're looking at the ECG, and I notice a heart rhythm of 80 beats per minute, and it appears to be normal sinus rhythm. Can we have a print off of that, please? Okay, and the ECG appears to be normal sinus rhythm at 80 beats per minute. Can you apply blood pressure cuff, please? And we'll take blood pressure for this patient. Whilst my colleague's doing that, I'm going to try and find out some more information from the patient. So, can you tell me what's been happening today? Okay. And how did that make you feel? Do you have any allergies to anything at all? And do you take any medications? Have you been... You take an aspirin every day? Okay. Do you take your aspirin today?
Yes.
Are you taking any over-the-counter medications at all? Just the aspirin. Okay. And do you take any other remedies at all? Okay. So have you got any past medical history that we need to be aware of?
10 years ago.
Okay. Apart from your heart attack 10 years ago, then, were there any other problems? You've not had any chest pains today?
No, I just feel unwell.
When you say you're feeling well, in what way are you feeling well?
Just tired.
Just tired, and obviously a little short breath. So what happened leading up to this today then?
Just been unwell for 2 days now.
Okay. And can you tell me what you've been doing this morning? Have you eaten?
No, I tried some cornflakes, but I didn't feel like it.
Okay, so you've not had anything to eat this morning. So the blood pressure's coming back, and the blood pressure is 140/60. So I'm happy with that for this patient at the moment. So I've completed my assessment of the circulatory system. I'm going to move on to look at disability. Speaking to the patient again, is the patient orientated to time, date and place? They are. Therefore, I believe them to be alert on the apathy scale. I'm not going to worry about Glasgow Coma scale at this stage. I'm going to move on then, and I'm going to ask you to do a blood sugar test, please. So what I'd like to do is take a little prick of blood from the end of your finger and just tell us how much sugar is in your blood. Because obviously if you're not eating today, then that might be one of the reasons you feel tired and unwell. Whilst my colleague's getting a blood glucose monitor together to take blood sugar, I'm going to move on to the final stage of the exam, which is to consider exposure and environment. I've already assessed the chest, and I'm happy with the chest. Nothing's changed on the chest. So, do you mind if I have a quick look at your abdomen? I'm going to expose the abdomen. Again, do I see any scars?
No.
No patches, and no rash. Okay. The abdomen doesn't appear to be distended.
No.
I'm just going to feel the abdomen very briefly. Nothing obvious in the abdomen.
Nothing.
And very quickly, just looking down the legs to check for any rashes or any other obvious injuries.
Nothing.
Okay.
BM is 4.9.
BM's come back at 4.9, and I'm happy with the BM. So that concludes my ABCDE approach to the patient.